Or my granddaughter.
That's great.
Yeah.
It is genetic.
Yeah, no, I understand. That's great. So, good morning.
Good morning.
How are you? Are you
Good. We're going to get started. We would like to get started, please.
I'll get out of your way.
All right. Is everybody there? All right. Good morning, everybody. I'd like to call our House Subcommittee on Behavioral Health to order. Madam Clerk, would you please call the roll?
Chair Braybeck.
I am here.
Representatives Arbit. Pahutsky.
Here.
Edwards.
Here.
McDonald. Here. Reingans.
Here.
Hersberg.
Here.
Schmaltz.
Here.
Hoadley.
Here.
St. Germain.
Here.
Thompson.
Here.
Madam Chair, you have a quorum.
Thank you so much. Representative Pahutsky moves to adopt the minutes from the November 7th meeting without objection. The minutes are adopted. Today, we will be taking up a vote for HB 5184 and HB 5185, also known as the Social Work Licensure Modernization Act. We have talked about this several times throughout the past 2 years here in committee. Much needed changes with data that we have. And so excited to have this in front of you, and excited to have worked with Rep. Edwards on these as folks who have this degree. It is exciting to be able to do some things to move forward. But first, we have an H3 substitute to HB 5184 and an H2 substitute to HB 5185. And basically what these would do is they would create, instead of a jurisprudence exam that we talked about, they would have a Michigan social worker exam, which would cover rules, regulations, and competency to be able to be a social worker in Michigan. So just changing that portion. The rest is the same that you have all seen, so no difference in any of that. So without further ado, Representative Edwards moves to adopt substitute 8.
Sorry, we didn't get a copy
Oh.
of these, so.
My apologies. I thought they were at everyone's desk. I'm so sorry.
That's not Claudia's fault. That's mine.
Okay, thank you. Great, thank you. So that was the change. The change is from a jurisprudence exam to this Michigan social worker exam. So everything else is the same in terms of the structure that we spoke about with the other bills and the requirements for supervision. So Representative Edwards moves to adopt substitute H3 to HB 5184. Madam Clerk, if you would please take the vote.
On the motion to adopt the substitute, Chair Braybeck.
Yes.
Representatives Arbit. Pahutsky.
Yes.
Edwards.
Yes.
McDonald.
Yes.
Reingans.
Yes.
Hersberg.
Yes.
Schmaltz.
No.
Hoadley.
No.
St. Germain.
No.
Thompson.
No.
Madam Chair, you have 6 yeas, 4 nays, 0 pass. The H3 substitute is adopted.
Great, thank you so much. And then Representative Reingans moves to adopt the substitute for H2 to HB 5185. Madam Clerk, would you take the vote on that?
On the motion to adopt substitute, Chair Braybeck.
Yes.
Representatives Arbit. Pahutsky.
Yes.
Edwards.
Yes.
McDonald.
Yes.
Reingans.
Yes.
Hersberg.
Yes.
Schmaltz.
No.
Hoadley.
No.
St. Germain.
No.
Thompson.
No.
Madam Chair, you have 6 yeas, 4 nays, 0 pass. The H2 substitute is adopted.
And then, we forgot to read it. And before we take the vote, we're going to read in all of the cards that we have. We have several of them. From not wishing to speak and opposing the bill, just HB 5184. Jennifer Henkel from the Association of Social Worker Boards. And then all of the next folks do not wish to speak, but are in support of both bills. Elizabeth Cutter from Michigan Hospital Association, Dana Pagilla-King from the National Association of Social Workers, Alan Bolter from the CMH Association, Jenna Friedman from Wayne State Social Work Disability Justice Coalition, Selena Soto from Detroit Public Schools, Curtis Brown, Detroit Public Schools, ALD Success Network, Hannah Gasper from Adrian Counseling Psychiatric Clinic, Catherine McComber from Saginaw Valley State University, Grace Sue Ming, I apologize for the last, if I mispronounce the last name, What do you think? Seculidis. Well done. And she is an LLMSW. Drake Dawson from CNS Healthcare. Marianne Cater from Dearborn Public Schools. Amy Garnett, Wayne State University. Department of Sociology and Social Work from Calvin University. April McAboy, and, oh boy, what do you think? Oh, I don't want to mispronounce Kelly's last name. Grinowitz? Kelly Grinowitz from the Office of Student Conflict Resolution from the University of Michigan. And again, all of those did not wish to speak and were supporting the bills. Okay, now we will have a vote to refer HB 5184 to Health Policy Committee. Rep. Edwards makes a motion to refer HB 5184 to Health Policy Committee as substitute H3. Madam Clerk?
On the motion to refer, Chair Braybeck.
Yes.
Representatives Arbit, Pohutsky,
Yes.
Edwards.
Yes.
McDonald,
Yes.
Reingans,
Yes.
Hersberg,
Yes.
Schmaltz,
No.
Hoadley,
No.
St. Germain,
No.
Thompson.
No.
Madam Chair, you have 6 yeas, 4 nays, 0 pass. HB 5184 is referred to the Committee on Health Policy as substitute H3.
Thank you so much, Madam Clerk. We'll now have a vote to refer HB 5185 to Health Policy Committee. Rep. Reingans makes a motion to refer HB 5185 to Health Policy Committee as substitute H2. Madam Clerk?
On the motion to refer, Chair Braybeck.
Yes.
Representatives Arbit, Pohutsky,
Yes.
Edwards,
Yes.
McDonald,
Yes.
Reingans,
Yes.
Hersberg,
Yes.
Schmaltz,
No.
Hoadley,
No.
St. Germain,
No.
Thompson.
No.
Madam Chair, you have 6 yeas, 4 nays, 0 pass. HB 5185, oh my goodness, is referred to the Committee on Health Policy as substituted H2.
Thank you so much. Rep. Hersberg moves to excuse all absent members. And colleagues, I just want to say will most likely be our last behavioral health committee as we're winding up the year. And so I'm grateful to all of you. We have tackled some pretty big issues, CCBHCs, social work licensure, many of the bills that Rep. Reingans brought. And so grateful to all of you for your work on these things. They will improve access for, if we are able to get them through our entire process. They will improve access for Michiganders, help our workforce issues, which we knew were the two biggest issues that we had coming into this. So I am grateful to all of you for your work and your partnership throughout these 2 years. And I guess we'll just see how the rest of our session goes, and hopefully we'll be able to get these across the finish line. So without any further ado, and there being no further business, this committee will stand adjourned. Thanks, everybody.